Hey guys, good evening. It's Therapy Thursday. It's another Thursday night. It's Dr. Delvina, your host of Therapy Thursday. And, I bring a special guest on for these Therapy Thursday shows. And tonight, I really wanted to give back to the women. I wanted to talk to the women. Some folks might be a little uneasy about watching this live and sharing their interest in this topic, which tonight's topic is women and sexual health, women and libido. We're talking about different disorders that can affect a woman's sex drive, aka libido, aka sexual appetite. We know that the benefits of sex extend beyond the bedroom. Studies have found that a roll in the hay can improve heart health and even boost your immunity. Plus, romps with your partner creates an intimate connection that's crucial for a healthy relationship. But if you're not always in the mood to have sex, you're not alone, guys, or I should say ladies. Many women have fluctuating sex drives, which may arise from larger issues. We know that. So if someone comes in with a low libido and it's a woman, we know that that may have a connection that is both emotional and physical. 6 years after Viagra revolutionized the sexual ability for men, I should say many years, I'm sorry. After Viagra revolutionized sexual ability for men, many women still hoping that they get some sort of relief. To date, the FDA has not approved a product to boost female sex drive. We know that low sex drive is the most common sexual complaint made by women. Somewhere between 30 to 40% of women complain about low sex drive, which is also identified as hypoactive sexual desire disorder. And on this slide, you see other complications or challenges that can occur that are considered sexual dysfunctions as well. We talked about, or I spoke of the desire difficulties. There's also orgasm difficulties, the inability to orgasm, and also pain, sex encountered or pain endured while one is involved in sexual activity as well. So anyhow, to have this conversation, I am bringing on an expert, Dr. Shrusan Gray, who is an obstetrician gynecologist. Hi, Dr. Gray.
Hi, good night, everyone. How are you all doing?
Hey there. So just to tell folks a little bit about you, Dr. Gray, guys, is a board-certified obstetrician and gynecologist licensed by the states of Florida and New York, and is an award-winning physician with an outstanding Ivy League education with extensive experience in her field. That's why she's here. She is the co-founder and owner of Women to Women OB-GYN. She is a graduate of the University of Pennsylvania Case Western Reserve University School of Medicine. Dr. Gray has been practicing medicine for over 15 years. She is affiliated with several South Florida hospitals, including Memorial Hospital West and Memorial Regional Hospital. Dr. Gray is highly skilled in all areas of OB-GYN, obstetrics and gynecology, and is adept at handling routine care and complicated issues requiring surgery and long-term care. In addition, she serves international patients from throughout the Caribbean, South America, and Europe. Welcome to the show, Dr. Gray.
Thank you. Thank you for having me. I'm happy to be here. And thanks for inviting me.
Yes, ma'am. And I'd like to add, I refer my patients to Dr. Gray, ladies who are looking for an OB-GYN. So thank you for what you do for the women, Dr. Gray.
I appreciate your referrals. Thanks.
You're welcome. So I know you are at work, you're in your office, and you are going to the hospital soon.
Likely, very likely. We have one in labor, so we're planning on we might be running out in the middle of this conversation, but I'm hoping that we could get through most of it.
All righty, so let's get the show on the road.
Let's get started.
Yes, ma'am. So the first question I have for you is to please summarize in general terms what happens to the sex drive of women as we're aging through the decades, like from 20s to your 30s to your 40s and your 50s. What happens with sex drive in general? What would you say?
Okay. So first of all, I'd like to say, I'm glad that you are approaching this topic. Because I think it's such an important one, and it's so prevalent. Because about 43% of women will have hyposexual desire disorder. through at some point in their life. So in a woman's 20s, she is considered to be at their highest level of sexual desire. And that's because while you're in your 20s, you likely have the highest level of testosterone. And I really truly believe that your level of testosterone is highly linked to your sexual desire. In addition to that, I mean, there's a lot of life issues that as we go through life that may affect sexual desire. But we'll deal with that, at a later time in the discussion. But at this time, I think the reason why we're at a high level of sexual desire in your 20s because of we have a high level of testosterone. And that begins to decrease as we go through our late 20s into our 30s. We'll realize that we have a decrease in our sexual desire when we're going into our 30s. Sometimes it has a lot to, life happenings. We have kids. Mm-hmm. We've been married for a long while. We have issues that causes stress and so forth, so on. But I think for the most part, it might be linked to the fact that we have a decrease in testosterone as we go into our 30s. So that's the first thing that we have to gauge. And then as we go through into our 40s and our 50s, we start to likely get used to that change in hormone, meaning your body physiologically get used to that change in your testosterone. But then we get into another bump, which is women start to go into their 40s, we get perimenopausal, and then we hit menopause likely in our late 40s or 50s. And then menopause brings to it a whole different challenge, where we start to, because of our decrease in estrogen, which is made, a large amount of it, which is made from our ovaries, and our ovaries are starting to, decrease its production of, or not production of eggs, or the amount of our eggs, our ovums in our ovaries, we decrease the amount of estrogen that is produced in our body. Estrogen production comes from not only our ovaries, yes, like sometimes peripheral fat, our adrenals, but a large amount of it comes from our ovaries. So we're going to have a significant decrease of estrogen coming from our ovaries, and that contributes to sexual desire a little bit, yes, but it contributes to our genital organs and the tissue of our genital organs and muscle integrity of our genital organs. And so therefore, sometimes that start to cause issues as far as how we enjoy sex and whether or not sex hurts, making lubrication. And so as we go into the 40s and 50s, we start to have issue with that. And as we're having issues with that, then it kind of feed back into sexual desire, because if we're hurting or we're having issues with how we feel in regards to us getting lubricated and so forth, then we're likely going to have just decrease in desire or feel in some type of a way when we are trying to have sex. And so therefore it loops back and feeds back on our desire.
Gotcha. So what you're saying is this is actually a rather a complicated subject to understand. It's not just saying.
And I think that's why a lot of gynecologists finds it very difficult to address even through a annual exam. So women, I will encourage women to speak on it at a GYN's, at their GYN visit or their GYN exam. But sometimes it does encompass a large discussion, and it's very deep in depth, and it's difficult to answer the question as to what is affecting your patient's sexual desire when she first approached you. It is really an involved discussion that involves a consultation that you will have to interview that patient as to what's going on in that person's life, what's going on as far as what was before, what was sex life before, did you have desire issues before, and then when did that change and so forth. So it does involve a large undertaking as far as history, the medical history, the psychological history, the social history, and the relationship history.
Okay. So in our 20s, you mentioned testosterone is higher. Can birth control pills lower our testosterone and cause reduced libido or sexual appetite problems for a 20-year-old?
I believe so. I mean, there's some studies that are showing that it does not. especially if you have it depends on the concentration of the birth control pill, the estrogen and progesterone. As you know, most birth controls is made with both estrogen and progesterone. So there are studies that shows that yes, there is some decrease in sexual desire with some birth control, and then there are studies that show that no, they don't. Well, I can tell you that there are a large amount of my patients that would come to me, and we put them on birth control pill, and they would come back and say, hey, something is going on. I feel like I am not as lubricated with this birth control pill, which is obviously going to affect the desire and sometimes sexual appetite, or feeling as if you're feeling of inadequacy, when you're about to have sex with your partner. But also they're feeling like they have a decreased libido. And the question is, the theory is that sometimes that combination estrogen and progesterone birth control pill with the estrogen factor does decrease your testosterone. So
Gotcha.
that's the concept there.
Okay. Okay, perfect. And so you were mentioning once we get into our 30s, life gets a little more challenging and complicated. Oftentimes women have children, they're parenting, they're working, they're building their careers. So these types of factors are stress. And I'm just going to pull up one of the other slides. And yeah, there we go. What can affect our libido? So here are some other factors in reducing sexual appetite, and that would be the quality of your relationships, the attitudes of your upbringing, qualities of touch and sex, understanding your partners, your age, as Dr. Gray was just explaining everyone, what happens in your different decades of life, illness, use of medications, emotional well-being. Does this look pretty accurate to you, Dr. Gray, as a women's specialist?
Yes, and the list can continue. Quality of relationship, will encompass whether or not there's relationship discord. Stress, definitely. But then we could talk also about anxiety. A lot of us develop anxiety due to just different life happenings, depression, history of sexual violence and abuse. A lot of us start to develop things like hypertension, which is under medical causes of hypoactive sexual dysfunction. Having to take medications, which are related to some of the things that we discussed before. Medications for anxiety, medications for depression, medications for blood pressure, oral contraceptions we talked about. You touched on the negative sexual attitudes. But then we also have to talk about neurological diseases that can affect your, different hormone uptakes or neuroendocrine uptakes in the brain. Personality traits, how you think about your body, your esteem, your self-esteem, and your body image issues. And then there is like even having a baby, pregnancy, the postpartum period, which could run for a while for some women. I find that in my practice, one of the most common times when women come in talking about their low desire, their low libido, is postpartum. And sometimes it's just hard to get out of that rut. You'd think, most women will come to me and say, well, I mean, it's been 2-3 months and I still don't feel like having sex. What is going on, and we'll talk about, just the nature of having a baby, vaginally, even C-section, or a difficult vaginal delivery where you have very difficult, very involved lacerations, and you've had to have a vacuum, for example, or forceps delivery. Sorry about that. My light comes off. Hold on 1 second.
Mm-hmm. So guys, you've been listening to Dr. Gray and me have a conversation about women and sexual desire or libido. And we pretty much, Dr. Gray has given us the summation starting in a woman's 20s, going into her 30s, her 40s. And now you're talking about postpartum. And you mentioned also, I think, menopause already. So we were going to talk about what happens in our 50s. Um, can you tell us a little bit about menopause and how that can affect libido?
Uh, that's the group of women for me that I have the most passion for, because I feel like sometimes it's hard to to manage them in regards to how mm, they feel like it's final. You know what I mean? Like, oh my God, it's
Yeah.
you know. So it's a higher level of sense of depression about their sexual desire, because they're like, well, menopause, I'm not going to grow back my ovaries, I'm not going to get no new ovaries, so then is this it? Am I not going to enjoy or have sex much anymore? Because this menopause is that transition in life where you can't go back. With postpartum, you can understand that there's an expectation that, okay, this period is going to pass and we can go back. So just the psychological aspect of that, feeling final about that, just already by itself put those patients in a mindset that allows for more anxiety and depression, which then feeds back into this hyposexual desire situation. And so by the time you have a proper gynecological visit in regards to why menopause allows for hypoactive sexual desire, I think just an open conversation in regards to the fact that, yes, it has to do with that there's a decrease in your estrogen level, which first, let's talk about the estrogen, the hormone, which is made by the ovaries, that decreases during menopause, and how that affects the female body. So that, as far as the genitals, so it affects your genitals because what? Estrogen is really what allows for your vaginal epithelium, the surface of your vagina, and the surface of your labia and so forth, to be engorged and has a different type of epithelium. Your epithelium is allowing for moisture, it's more thickened, it's more rugated, meaning that it has the grooves and so forth, and there we go. And then we go into menopause, where we have a lack of estrogen. And that lack of estrogen allows for that epithelium to dry out, to thin out. Those are the most important aspects of what happens during menopause, right? It dries out, it thins out, and there's decreased lubrication during sex. That triple happening for menopause allows for painful sex. That painful sex allows for feedback of hypoactive sexual desire, right? Because if you know that when you have sex, it's going to hurt, then the next time you're not going to want to have sex again, right? It's going to be a continuous. So when patients come to me, they're saying, oh my God, it feels like, most people will describe it as, it feels like razors in my vagina, or it feels like, paper cuts, like getting tiny little paper cuts. So I just want to be just very blunt about, that's what a lot of women, when they're approaching menopause, start to feel as they're having sex, as they're as they're trying to, have sex. And so that's one of the major issues. The second major issue, obviously, is a decrease in testosterone that has been happening since we talked about it. In most women, it starts in their 30s and it's still going down. And it literally goes down to, it plateaus as you go through menopause in your 50s and your 60s. So that's a part of it, because again, testosterone, there's some level of testosterone that comes from those ovaries, right? So when the ovary doesn't work anymore, then we're having that decrease, even much more decrease in testosterone. So you get your second round of drop in testosterone. So we're having that sexual desire combined with the fact that we're having, urogenital changes in our genital organs. Then combined with those, there we go. We have like hyposexual desire at full blown there. So that's how that works in menopause.
Okay.
And not to mention the psychological aspect of knowing that, right?
Right. Yeah. Yeah. Double whammy. Double whammy. And you just answered one of the next questions, which was, do women make testosterone naturally? And you just said, yes, women make testosterone. And
Exactly.
where does the testosterone originate from in a woman's body?
So we have testosterone coming from your adrenal glands, which complicated. I don't want to complicate the situation.
Yeah, no. Yeah, no.
But they're glands that sit on top of your kidneys, and it makes a lot of, it's involved in a lot of steroidal processes and a lot of hormones. So that's one of the hormones that are made there.
Yeah.
It also comes from your ovaries. And there are some women that, and there are some from your peripheral organs and fats, your subcutaneous tissue. So say, for example, there are a lot of women who have a high level of fat percentage in their body. And you'll notice that when we do their labs, their testosterone can be higher. And I'll give you an example. For example, women who have polycystic ovarian syndrome. One of the things that we check when we're checking to make that diagnosis is the androgen levels. Androgens refer to stuff like testosterone and DHEA. Androgenic hormones is what we call them. And we'll notice that patients who have PCOS have a very much higher level of testosterone, just to give an example. So we know that these women, when you look at their ovaries on ultrasound, very polycystic, large amount of follicles, and they tend to have a much higher level of testosterone, sometimes double or triple the amount of testosterone than if we have a woman that did not have polycystic ovaries.
So Dr. Gray, does that translate to having a higher sex drive for these women who have PCOS, polycystic ovarian syndrome?
That's a good question, because when we're doing the research, the question, there's some research that shows that that counter that says, well, I mean, women who have high testosterone levels do not translate, into having higher sex drives. I definitely differ. And then there's a lot of research that says the complete opposite. In my practice, I would say that when I interview most patients, and we're talking about, their testosterone levels, and your testosterone levels is in the hundreds, or your free testosterone levels is in the double digits. How do you feel? Do you have a high libido? And it will translate to, yeah, I do.
Okay.
So yes, it does.
Okay. So I've had some patients who've told me that they were prescribed testosterone. They were given a testosterone patch. They were given injections to help with their libido. These are women who were in their 40s and early 50s. Is that okay to give women testosterone to help with the sex drive, the sexual appetite?
Well, it depends on the physician and the patient and the discussion that they have. It is a common practice. There's now being used in hormone replacement therapy. You have pellet therapy. I'm not sure about injections. I wouldn't do injections if I were anyone. But there's a pellet that a lot of women are getting placed, and it does impressively improve sex drive. Patients who are getting hormone replacement therapy or bioidentical hormone replacement therapy, which usually includes a combination of testosterone, estrogen, sometimes DHEA, which is another androgenic hormone, some women are very happy with it as they're menopausal. It's increasing not only their sexual desire, it's increasing their orgasm, it's increasing their energy level, which just increases and improves their well-being all around, which improves their relationship quality, and therefore just all around improves their sexual desire issue. I have prescribed topical testosterone and referred out for pellet therapy. So it depends on the patient and whether or not they absorb or understand the risk factors that are involved, and the side effects and the potential risk are usually very, very low. But some people just want you to tell them that there's no risk in anything. So it depends on the patient. And so, if you put testosterone on a certain area, you tell people, I will give you some testosterone. Some women are like, oh no, it's going to make me look manly, or so forth, so on, or I don't want to grow hairs, and so forth, so on. So it depends on what the risk level that the patient is willing to absorb.
Okay. So let's move away from testosterone. I know you got to go deliver a baby. What are some FDA approved agents that you can tell us about that can help enhance a woman's libido? I think you mentioned a couple already.
Okay, so I mean, estrogen creams and are is one that we use, and we use that commonly in OBGYN. And the reason why we use it is because it's definitively directed at the problem, especially when we're going into menopause.
Okay.
And even though it is for vulvovaginal atrophy, we found that it does show that there's increase in libido, because if a woman feel if the vagina and the vulvar is feeling healthy and we're increasing blood flow to the clitoris and all those places, guess what? Your sexual desire is going
Yum,
to
yum, yum.
improve, right? So,
Yeah.
there's some doctors that would, especially, that would defer on that. I find it not to be deferred at all.
Yeah.
One of the things that has recently come out, and I've used once or twice, is Testosterone, which is a vaginal gel with DHEA. Now, remember we talked about DHEA being also another androgenic hormone, and some that's used in pellets. Well, now there is usage of it vaginally, and that's FDA approved, and that's shown to be improving sexual desire.
Okay.
Um,
Okay.
then there's other modalities. The wonder of we do Mona Lisa Touch, which again, it's supposed to be improving vulvovaginal atrophy, which is a laser that we use to treat the vagina, and we do it in our office here. We get very great response in regards to it, and yes, it's not really working as far as the desire aspect of it. But again, if you're
Mhm.
increasing, if you're using something that increases the improves the vaginal atrophy and the vaginal tissue and allows for increased lubrication, patient is going to be happy. Likely, patient's desire is going to be improved.
Yes, yes, yes. And you call that Mona Lisa, the
Mona
procedure that you
Lisa
do.
Touch.
Okay. All right. So let's see. I'm into alternative health
Mm-hmm.
also, not just Western medicine and medications. And sometimes people ask about herbal remedies.
Mm-hmm.
And, I tell them for mental health and wellness, I'm not qualified to talk to you about herbal remedies. And so I don't go into a whole lot of details about what herbal remedy they bought from the herbal store, or whatever you call it, the naturopathic store. Um, but question for you, do you know of any herbal remedies that women can use to help increase their libido or sexual desire?
Well, there's one that I recommend, and it's not much, so I can't speak on much. But I do believe in saw palmetto. Saw palmetto is, I mean, it comes from a tree. I'm not even sure if I know exactly where the source is, but it's something that you can go to pharmacy and get the little pills or so forth with saw palmetto. It's also in a lot of products which improve hair growth, especially in women that are having what would you say now, changes in hormonal hair loss. And the reason why saw palmetto works is because it does improve your testosterone levels. So a lot of things go right back to that,
Oh, go
right?
back to testosterone.
And
Yeah.
because it does inhibit the one of the what would you call it now, enzymes that break down testosterone. So saw palmetto kind of stops that and therefore increases the testosterone that you have in your body at that certain time. Um, and I find that, and saw palmetto is herbal. I mean, they've been
Mhm.
using it for many years. Some doctors usually recommend it back in the days for like patients with BPH, prostate hypertrophy in
Mhm.
males. And but we see that saw palmetto can increase your sex drive. And I will try. It's not going to be like testosterone where it's as potent, but it does, I've seen that it does increase sex drive in some women.
Okay. Okay. Perfect. So let's move into another alternative intervention being food. People like to eat or use their nutrition to help resolve issues that they might be having at the time. So this is a slide showing foods that are thought to enhance sexual appetite or rev up sexual appetite, aka aphrodisiacs. And there's also food that's listed that is thought to reduce your sexual appetite or your sexual libido.
Mhm.
What do you think about the foods that reduce your libido, the sugars and things like that?
Well, it's definitely shown that foods that are high in sugar does increase your okay, does decrease your sexual desire, and the evidence of that comes just to prove how true that is that you can see that it shows that patients who have diabetes and insulin resistance, especially those that have due to a high sugar, high carb diet, do have a much higher incidence, significantly higher incidence of hypoactive sexual desire. So we know, and that goes along with processed foods. We also know that high alcohol intake does decrease your just increase your risk of hypoactive sexual desire. And so we know that those things are in fact true. It's thought that a diet that's high in, like a Mediterranean diet that's high in nuts, fruits, vegetables, fish, does improve your libido. And that's definitely has been shown. Dark chocolate, I see chocolate is on the list. That's a good thing to know. Right? I think most people will be happy with that at least.
Yeah, dark
Just in
chocolate
case
to
I'm
help
just in
chocolate.
case I'm bursting anybody's bubble and not trying to want those persons are like, man, that's the end of that cake tonight.
Ah,
Go eat some chocolate.
all right. The world isn't perfect, and so is technology. So
Yeah,
we were just, I thought it was you. I was like, oh, what happened
no,
to
not
Dr.
at
Gray?
all. I was
She's
like,
black.
I'm here.
Yes. Okay, so I have a couple other questions and then I'll let you go. I know you got to go deliver that baby. What do you think about masturbation for women? Is it helpful?
Of course. I mean, you know, anything that masturbation sometimes increase the comfort level, as far as your comfort with your body, your sexuality, your what pleases you, what allows for you to have an orgasm, and it increases blood flow to your sexual organs. So I believe that if it's safe, there's nothing wrong with it. Masturbate.
Okay. That is the safest form of sex is
It is.
masturbation.
If it
Now,
works for you.
yes, what types of products are the safest, more effective to combat vaginal dryness? What types of lubricants would you recommend?
Okay, because um, sometimes what's the most effective might not be what's considered the safest. So, but lubricants, I would say ones that are natural. I think there's right now, I mean, there's not a lot of space to me, or not a lot of place for me for vaginal lubricants where you have a lot of stuff with parabens and detergents and stuff that throws off your pH. There's so many natural lubricants out there. I mean, we have stuff with guava bark and kelp that works, and you can go to the especially to specialty pharmacies. I send my patients, for example, to Pillbox, and there is a friend of mine over there, Angela. She's very good. She's a sexual dysfunction. She has her PhD in sexual dysfunction, and she's very good at assisting patients in getting natural lubricants that will help them, and it's good for their vagina, because the vagina is so easily thrown off. As soon as you throw off the pH, then, if you had urogenital syndrome before, then it's going to be worse. Abnormal discharge, you end up with BV, bacterial vaginosis, a yeast infection. It's such a tight balance. And so when you start using lubrication, as simple as it sounds, lubrication, it could have things in it that just throw off your pH and your
Yeah.
balance. And so I think it's usually pretty a good idea for you to seek lubrications that have natural components in them. I tend to like things that have natural oils. Like, for example, we have a vitamin E suppository. And I mean, you can go to the pharmacy and you can ask for just the key vitamin E suppository. There's this one here. I'm sorry, this is not good. Ooh, stuff.
There we go. Yep, we can
Oh,
see
yeah.
it now.
So, I mean, you can just go to these specialty pharmacies and, you know, use a vitamin E suppository, put one in every few days, and it will allow, I mean, some people really actually feel the dryness of the vagina, even if they're not having sex. But if you, you know, even to prepare your vagina for if and when you do have sex, you know, using vitamin E suppositories are usually considered to be very beneficial. And then you have suppositories that are have prebiotics and they're pH stabilizing. I mean, I know there's one called Luvena, for example, that I encourage my patients to use because it usually helps in balancing the pH. There's also one called Lubrigen, also natural, has vitamin E, it has hyaluronic acids. Things that have hyaluronic acid tends to have a good decreased friction and helps to give um, give the vagina this feeling of not that thinness that you have when you're you know, you're getting atrophy, vaginal atrophy.
Mm-hmm.
And then, you know, you have now stuff that has guava bark. For some reason, we're showing that that does improve, you know, lubrication.
Okay. All
Mm-hmm.
right. Well, so that was the last question. There is a question from the audience about, I don't really understand it. How are patients with coagulopathies and low sex hormones? What's the recommendation? I'm not really sure.
Well, I think what the
Asking.
first part of the question is is referring to patients who are not able to
Use,
coagulopathies, meaning that it's,
yeah.
you know, like high risk of blood clots.
Mm-hmm.
So those
Mm-hmm.
patients, it's contraindicated for them to use estrogen.
Hormones, estrogens. Yep.
Hmm. So I think we just touched on a lot of um, options for those patients. If
Yeah.
we're talking about patients who are having vaginal dryness or urogenital dysfunction due to menopause, I'm not sure if, you know, if that's what she's talking about, because there's so many different patients. So
Right.
which
Right.
population are we talking about? Are we talking about patients that are going through menopause or pre-ovarian, you know, menopause, ovarian failure? You have some poor patients, the younger population of patients who have had breast cancer and status post chemotherapy or after chemotherapy, and now has very decreased ovarian volume, and so therefore have gone through premature menopause as a result of treatment on their, you know, for
Mm-hmm.
their breast cancer. And those patients is it's very hard. And so, you know, usually we cannot prescribe um, estrogen therapy or anything with hormones because of the fear that that type of cancer is hormone receptor positive. So in that case, what do we recommend for those poor patients? And sometimes, really, a lot of those patients, especially when it comes to hypoactive sexual desire related to vaginal atrophy due to their the treatment, is we do laser therapy, you know, and we recommend lubrication. But for a lot of these patients, the lubrication is just not enough of a long-term option for them.
Mm-hmm.
And
Mm-hmm.
so the laser is becoming a big thing for those
Okay.
patients.
Yeah, she put ovarian failure and menopause.
Oh, okay. There you go. There you go.
Yeah.
So
So, Sakina Mattis, thank you for the question. I suppose the highest recommendation during this broadcast would be to schedule an appointment to see your gynecologist and discuss it in detail so that you get all the right recommendations or
yeah,
the,
because it's based on that particular case.
Yeah. Yep. Well, Dr. Gray, I will not keep you. Guys who are watching, I'm going to do some myths versus fact to see how much you learned during the broadcast, but I'm not going to keep Dr. Gray
All right, I'm
during
gonna
that.
run.
Go deliver your baby. Thank
All
you
right,
so
take care,
much.
guys. Take care. Bye bye.
All right. Ciao. Okay, guys, so let's play a quick game of myth versus fact so I can see how much you learned during the broadcast. Yay! Everybody ready? So, problems in a relationship can reduce sex drive. Is that a myth or is it a fact? What do you guys think? Problems in a relationship can reduce sex drive is a fact. Yes, problems in your relationship can definitely reduce sex drive. All right, next question. Sex drive often increases with age. Do you guys think this is a myth or a fact? Does sex drive increase with age? That is a myth. No, sex drive does not increase with age. Now, some people would say that that's true, and it depends on how you look at it, right? Because as we get older, we make less estrogen. We make less estrogen, but because we're making less estrogen, there's a thought that we're more sensitive to our testosterone or that we may be making a little more testosterone. And you just heard Dr. Gray spend the last 30 to 40 minutes and discussing testosterone and how it's helpful for sex drive or libido for women. But overall, we know that sex drive often decreases with age overall. So, myth versus fact. Is this a myth or a fact? A man's main complaint, sexual complaint, is erectile dysfunction. That's the most common sexual complaint from a man who has sexual dysfunction is erectile dysfunction. That is a fact. The most common sexual dysfunction for men is erectile dysfunction, whereas the most common sexual dysfunction for women is just reduced sexual appetite. Myth versus fact. Is this a myth or is this a fact? Breastfeeding can reduce libido. Breastfeeding can reduce or decrease your sexual appetite. What says you? Does breastfeeding reduce your sexual appetite? And that is a fact. Yes, breastfeeding in many cases has been known to reduce sexual appetite or sexual libido. It makes a woman feel less sexual or desire sex less. Myth versus fact. Estrogen, which is a hormone that women mostly make, can lead to reduced libido and dry vaginal tissues. Myth versus fact. When your estrogen levels decrease, reduced estrogen levels can lead to reduced or decreased sexual desire, sexual appetite, and dry vaginal tissues. That is a fact. Yes, so as estrogen is decreasing, your sexual appetite goes down and dry vaginal tissues can occur. Myth versus fact, guys. You're doing a good job with this, by the way. Stress, anxiety, depression, and poor body image can all affect libido by reducing your sexual appetite. So myth versus fact. Is this a myth or a fact? Anxiety, depression, stress, and poor body image can lead to reduced sexual appetite or desire. That is a fact. Yes, because if you don't feel great about how you look, if you don't have self-confidence in being naked and being seen by your partner, and also if you're thinking about all the stresses in your life, the job that you have that you hate every day, the bills that you have to pay, or you might get kicked out of your apartment or your home, no one is thinking about sex, right? So yeah, that can reduce your sexual desire. All righty. So here's the last one. And this is the last one because I'm in my 40s. I'm 45. And I know some of you are in your 40s too. In your 40s, you can feel sexually liberated. Is that a myth or a fact? Women in their 40s feel sexually liberated. Myth versus fact. Most women in their 40s feel sexually liberated, meaning sexually free. You feel like your sex life is better. You feel more comfortable. That is a fact. Yes, women in our 40s feel a little more, much more sexually liberated. And that's because our 40s are a time of confidence and exploration. For most of us, most of our children are older. They're not little kids anymore. They're a little more independent. They're taking care of themselves. And our careers are established for the most part in our 40s. So we have less things to be worried about, to be concerned about. And by our 40s, we know our bodies. We know our bodies. We're comfortable with who we are. We have grown into our bodies and we respect our bodies. We care for our bodies. We understand our bodies and we like ourselves by our 40s. We've learned to overcome some of our mental shortcomings when it comes to not having a perfectly sized breast or booty, or having lips on the vulva, on your vagina that look a certain way that you were embarrassed about when you were a teenager. I've spoken about that before. I've had a guest on a Thursday night discussing that. And so in your 40s, you feel more free, you feel more comfortable. And so this means that you know what turns you on and you're opening yourself to the sexual experience, and strokes and touches and all of those things can bring about more sexual pleasure, including orgasms. So, ladies, remember, don't give up on sex. Don't give up on your sexual appetite. If it's not there, think about the things that Dr. Gray and I discussed during this last 40 minutes, and you too shall enjoy sex. You'll have a pleasing sexual appetite. Remember to do things like have open communication with your partner, talk to your partner about what's working or not working in the bedroom, do things together, and you yourself should learn ways to relax, like listening to music, taking a bath, having a glass of wine. And if you are having a conversation with your partner about sex and intimacy, don't make it a long, drawn out conversation. Don't feel like you have to attack and address and find resolve for the issue all in that one conversation. Maybe talk 10 minutes at a time, 15 minutes at a time, and go back to it. Just repeatedly go back to it. Take small bites, small chunks out of the problem until you guys come to a solution. And admit when you're uncomfortable. Admit if something doesn't feel great to you, if it doesn't feel well to you. Be able to talk about it, talk regularly. And if you have a problem with talking about sex and intimacy, use a book to help you explain what you like or dislike. Use a movie. You can use one of your favorite movies and explain to the person, see what he just did for her, that's what I like. If it's difficult for you to express yourself, and explain it. And just know this, if you're in a relationship that you're unhappy with, or in a relationship that includes abuse, whether it's emotional, physical, sexual abuse, you will not be happy in that relationship, and that will translate to you not having a healthy libido or a healthy sex life. You also have to have romance. Women and men too enjoy romance, so be sure that you guys are exchanging ideas and understand one another's love languages. That's important. And know what gives you pleasure, and know how to explain it and express that to your partner. And when the sex has become too routine, you gotta mix it up. You gotta try some different things. Try to change the setting, go away on trips. Go to the beach and just sit in the back of your SUV or your pickup truck or something like that, or your minivan, whatever it is that you have. And talk to your doctors when you're noticing physical changes, or if you're on a certain medication and you notice there's changes. Doctors know that these things happen. Your physician will know, and will know how to address it. So don't accept low quality relationships, including the sexual part of your relationship. You can remedy these things by utilizing some of the things that Dr. Gray and I have spoken about during this podcast. Thank you guys for coming on to another Therapy Thursday. I appreciate it. I know this is a sensitive topic. And for the folks who did not want to be on live and be seen watching, hopefully they'll watch later. It will also be on my podcast, the Brain Love Podcast, on a Sunday night with additional information. Everyone have a great night. Thank you. Brain love.